Hey everyone, Dr. Rimka still here. How to reconstitute dry peptides. Okay, we have two different examples we're going to end up going through. So we're going to have a dry peptide and how to take your backwater and put it in there and how to dose it properly to do an injection. Then I will also show you how to take the dry peptide and make it into a nasal spray. All right, so let's go step by step here. All right. One, you're going to need needles and you're going to need water. Okay. Now you can't use water from your tap. It's called reconstitution water or bacterial static water. We'll give you a link on Amazon. I have no affiliation with anything, but basically it's just a brand that I like. Medical supply stores you can get these things as well. This gives you an example. It's exactly what I have in front of me. All right, now you're going to need insulin needles. They come in 3 different sizes. When you have the 3rd milliliter, it is 30 units, means has 30 little notches on it. Then you could have one that could have 50. You could have one that have 100. Why would you make the difference? So I think to have at least a 30 and 100 makes sense. So you can get all 3 different if you like. They come in little bags, and I think 10 are inside a bag usually, right? It's usually 10 inside a bag, and then you can get a whole box. You can't just buy individual. They're like, give me 2 bags of this, 2 bags of that. I know in Georgia, we can just walk in and do it like that. Every state's a little bit different. You got to check on your laws and how you get state things. So why would you make the different choice? Because let's say, for example, my dog's insulin is 5 units. That's how much insulin I always draw. I use a 30 unit because there's more room in between each line and I can see the 5 units easier. I can still use a 100 unit needle. It's just harder to see 5 units because typically they're expecting you to do 50 or 60 or 70 on there. So the lines are closer together. If you're only doing something that's 2 units, you want a 30 unit needle. If you're doing something that's 20 units, you could pick any of the needles, right? But to me, if something's under 10, I would definitely be trying to use the 30 unit needle. And if it's over 50, go with the 100 unit needle, all right? You'll see when we get into this calculator, we're going to have to use this. You're gonna have to use this every time, and it's best you basically write down for what you're doing. Okay, BPC, I pull it to this. KPV, I pull it to this. Tirzepatide, I pull it to this. And then you'll understand, and you don't have to have it memorized. You don't have to look it up every single time. All right. So again, I just went through what you're going to have to know. What is the volume of the syringe you have? And you're going to go through on this chart on the website. I'm going to show you exactly, but you basically pick the peptide vial. So what do I have? I literally have Melanotan 1. I'm going to give this as a bonus, but this is what I have sitting here. And it is 10 milligrams. So I would go in and calculate, I would click it to 10 milligrams because that's what I'm using. And I'm going to put always in 1 milliliter of bacteriostatic water. So always stick with that, which is going to be 100 units. 1 ml is 100 units. You have to know that. Okay. So then I'm going to put that in there, and then I'm going to say how much of a dose of the peptide. You're going to have to use your dosing guideline to know how much am I dosing to come up with an accurate dose. So I'm going to show you how to do this all, and it's going to tell you where the dose here. It's going to color it in for you, and you'll know what syringe, where it's going to go. It's going to be real easy. Okay. You have to make sure, the thing you have to know about putting in the peptide quantity is it's going to be in micrograms. And if you're dealing with milligrams, you're going to have to make the conversion, but I'm going to show you that. Okay. We're going to go through it step by step. It'll make more sense. So I'm going to show you how to use the calculator. You need to get these needles and you need to be able to do this. So let me just actually come off of here. Here's an example, but I'm going to show you how to do it. So again, this is to give you an example of the links. This would be 31 gauge, what we're looking for in different sizes. This is 100 unit, and you might want to get something different. Again, I keep 30 unit and 100 units on hand. So here's the calculator, right? This is real time. So let's say I'm going to reconstitute alpha 1, okay, TA1. So this is a 10 milligram bottle. So I've got 10 milligram. I'm going to put in 1 ml, okay? If you didn't watch, you don't have to have these memorized, but immunity dosing. So what's a dose of TA1, thymosin alpha 1? 1.5 milligrams. Let's say we're going to settle in on that's what we're going to do. All right, so let's go to the calculator. I have a 10 milligram dry. I need to put 1 ml of bacteriostatic water in it. And the dose is make sure I'm saying 1.5 milligrams. Okay, so 1.5 milligrams isn't the same as micrograms. So how do we know what to do? So here's what I'm going to say, and then you pick which needle you're using. You can go with that. So something I like, don't know anybody messing around with it, right? Micrograms to milligrams. Really, yeah. So in case you ever don't know what to do, you just do this. You can do it on a computer, you can do it on a phone, right? We need 1.5 milligrams. 1.5 milligrams is 1,500 micrograms. All right. I need to put other in here of 1,500 micrograms because that's 1.5 milligrams. Hit enter. And I take the syringe to 15. Now, it really doesn't matter which syringe I use. It's still going to be 15. Okay. It's just going to look different. It's a little harder to see. So no matter what needle, that's what it's going to be. So my thymosin alpha 1 dose is pulled to 15. All right. So let's actually reconstitute and show you. Okay. Thymosin alpha 1. I have 100 ml needle, alcohol, swab. Now, a brand new one is going to look like this, and you're just going to pop that off. I'm not really ready to reconstitute any of some of my new ones. So I'm going to show you on thymosin alpha. I'm going to draw it back because I want to put air into the backwater. And then draw it out. And you'll see it just slowly fills up. And I'm going to let it go all the way slowly, filling past the 100. Take it down, and then I let the bubbles titrate up. Then I push it up to the 100, that black line, so I'm right at that. And now I've got a really nice needle with no air bubbles. But if I was concerned, I can just click it and push it up, and those little air bubbles are just fine. Then I take that and I put that inside that little tiny hole right there, and then I'll push all of this water into here. All right. I am not going to actually do it because I don't need to reconstitute one right now. All right. So you push that into here. Then I move it around. You see all the backwater that's gone in there? I move it around. I open it up. I don't shake. I especially do it upside down because a lot of the dry peptides stick to the gray vial closure, right? Do not do any rapid shaking. Now I'm just putting this back in because I don't need it. So imagine I just put that all in there. I shook it. Okay. Now to draw it up, I'm just go ahead and I'm gonna use the same needle because I didn't actually do anything with it. And I go to 15, which is harder to do on 100 because there really isn't. The line's a little bit harder, but it's what I have available. So I reconstituted and I've loaded Thymosin Alpha dose, and that's ready to go. All right. Now to actually do an injection, it's not that complicated. You pick a fatty area. I'm happy to do a Thymosin Alpha 1 dose for myself right now. Okay, so I'm just coming off a lot of travel, a lot of fatigue. So typically you're going to use subcutaneous on the belly. You could do inner thigh as well. It's very easy to do that. And when you have to rotate locations, let's say for tirzepatide or something like that, belly, left thigh, right thigh, 1 week belly, the next week left thigh, another week later that. So I'm going to show you. So ideally, you come in, you got to pull that skin. You got to find some fat a little bit there, okay? Take some alcohol. It's a little bit longer needle than I'm actually used to. I usually buy it a little bit shorter. So I'm going to use a little bit of fast speed firmness, okay? And then I do it slow-ish. That's it. There's no bleeding. You can rub with alcohol if you want. There's nothing there, okay? Then I dispose of this needle in a appropriate, I buy the medical waste disposal thing, or you can use like a plastic jar container, you get them and seal them, but I do drop them off to be disposed of properly at a local pharmacy, but you never reuse it. Okay, I took 1 ml, put it inside the dry, moved it around, had looked up my dose, so I know Thymosin Alpha 1, I'm pulling to 15, okay? Put that little handy dandy in my notes, right? Oh, Thymosin Alpha goes to 15, right? You can write down, oh, do it 2 to 3 times a week for acute. You can put everything you need to know about it. You don't have to memorize anything, all right? Now, let's do another example of a different dosing, different amount. All right, so let's do the example of tirzepatide. And because that is the next example, we can show you that clearly. So that's a 5 milligram bottle. Okay, so we're going to put 1 ml. Let's go with a 1 ml. So same concept, right? And tirzepatide, say the dose is 2.5 milligrams. What is that? How do I know what 2.5 milligrams is in micrograms? It's 2,500. So let's write that down over here, type it in. 2,500 would be, oh, we pull it to 50. So it makes sense we use the bigger thing. So why did I show you that? So let's just show you the example on how we would use this with tirzepatide, right? So again, you have to have the needles. And again, if you were going to do 50, if I only had a 30 unit needle, I would have to use 2 shots. I'd have to draw 1 to 30 and 1 to 20 to get me to 50. And I have to do 2 different injections, right? So a 5 milligram vial of tirzepatide, you put 100 units of backwater in it. It's going to have 2 injections of 2.5 milligrams. So that's 2 weeks worth of tirzepatide as an example. 2.5 milligrams equals 2,500 micrograms. That's how that's critical. You convert this properly when we do that. So this will show you it's okay. We went through that 5 milligrams when we reconstitute it, 1.5 milligrams looks like 30 units. 2 is 40, 2.5 is 50. Sometimes you might want to go through this for your different dosing for what you're doing. So then you have it listed out and you're very clear on what your dosing is going to be. So let's say you are doing tirzepatide and you're at 4 milligrams at this point in your journey, then you know it's to 80 units, right? And you'll follow the dosing as has been described. Okay, so reconstituting a nasal spray is even easier, okay? So when you purchase something like your N-acetyl C-max amidate or oxytocin, so here we go. We've got, going to come with the C-max bottle, with the C-max here that needs to be reconstituted. So what do? You're going to take your brand new 1 unit, a brand new 100 unit needle. Okay. You're going to open, because this is just bacterial static water. This is your dry, unconstituted peptide. Here's your C-max. So you're going to come in here and you're going to draw up fluid. You're going to draw up all of this fluid. Okay. So you're going to get a whole bunch of fluid inside of here, your water. Okay. Then you're going to take that inside there and you're going to push all of that water inside of here. Then we're going to mix it up. Then we're going to, you take the same needle and you've got to pull all of this in this bottle back out, the reconstituted peptide. Okay, you pull it out, every single drop that you can get out of here, and you just squirt it right back inside. Okay, this is all pretend right now, but then we're going to take it. So basically, we're going to take this out of here, put it in here, suck it back, and put it all back in. You just empty this back into here, but you got to use a needle to do it. You don't have to measure anything. And it's ready to go. That's what you'll do for every single nasal that comes. It'll come with the dry, with this. This is your bacterial static water. It's ready to go. It's ready to dose. All you have to do is use the needle that comes. You're going to get a needle. You should. Then you just pull the 100. You just pull about 100 out, 50, 60, doesn't matter. You don't have to be perfect because you're just pulling fluid from here and putting it in there, moving it around, doing what I said, making sure the gray part, spend 30 to 60 seconds, nice, rolling it around. Everything gets a little cloudy. You'll see it start to create itself. And you're like, okay, then you just take the needle and suck this back out of there. Suck everything out of here, put it back in here. And then this is ready to go. Okay. That's C-max. That's a daytime energy. Not going to do it. Oxytocin, be the same thing. And oxytocin will come. You'll pop everything off. You'll do that. And then it's ready to go. Oxytocin. I can do it at night because it helps me go to sleep. Don't do the C-max that way. Okay. And I keep them in the refrigerator after I reconstitute them. The nasals are really easy. And what Chris, the owner of Limitless, has told me, soon he's moving to, soon, one day it'll change. You won't get a dry peptide like this. The peptide's going to be inside here. And then he's going to send another bottle with the amount of fluid, and you just have to pour it in. And you put it on, and that's it. And then you're going to reconstitute it right here. You won't even need to do the needle back and forth. So he's working on making it even easier so you won't have to measure anything, which is really fantastic. But for now, 2 things are coming like this. Okay. Okay, everybody, I'm back. I'm going to go ahead and show you how to do Thymosin Alpha. So I've drawn it to 15 units, like I just said. So we got 1.5 milligrams. This is my nephew, Kyle, and he's sniffly. He has a cold. Had it for about a week. So he came down and I'm like, we're going to take care of it. And he said I could go ahead and record and teach you guys how to do it. So I keep a lot of sterile alcohol pads. You can have these, and I like these ones simple. So what we're going to do, it's subcutaneous. So I just explained to Kyle, I have to get a little bit of fat on his belly, and then I'm going to clean it with alcohol first. So why don't you go ahead, lift the shirt a little bit. I'm going to grab it. I'm going to do this for him, obviously. So see that? Everybody's got a little bit. He's a lean guy. How old are you now?
26.
26. Okay. All right, here we go. Now he's never had this done. I just showed him what I was going to do to me. All right. So here we go. 1, 2, 3. Did you even feel it? Nothing. Okay. So we're gently going to put it in. Were you scared when you saw me do it? Did it look scary?
It didn't.
Okay. Do you feel anything?
Nope.
I'm going very slowly because he's never had this before. Sometimes it can burn. Do you feel anything?
I don't.
Nothing. Look, no blood, no nothing. I'm going to run over a little bit of alcohol just to do it. And we're all set. You feel okay?
Yeah.
Now it's a little reddish because I was pinching and poking at it. Now, all I'm going to do is, so this is, what day? This is actually Thanksgiving. So happy Thanksgiving. You're watching it delayed. And so I'm going to do that again to him on Sunday or Monday because they're leaving on Monday. So I'll probably do it on Sunday. So I want to make sure I have 2 injections, 2 for the week for this acute situation. He's had a cold a little bit longer than we would like for 2 weeks. And he has a history of things dropping into his chest, and he has asthma. We don't want that to happen. So I'm like, oh no, let me just take care of this. Okay. So you're going to go to sleep right now. It's late. He waited for this, and you're going to wake up, Kyle. You're going to feel like $1 million.
Hopefully.
Hopefully. Thank you so much. So you saw it step by step. Having the thing, filling it up, using the calculator. Oh, that's my dose. So in a few days, 2 doses in this week, I'll do the same thing. 15 units, and all of these needles will be thrown away appropriately since I stuck a needle in it. And that's all you do.